Is I'd like to maybe in front of the media you can go around to table quickly, just introduce yourself and your association, your hospital, or whatever it is, whoever you're representing, and say a couple of words if you'd like. Please, we'll start with you, Sam.
Thank you, Mr. President. Sam Hazen, CEO of HCA Healthcare. We have 185 hospitals across the country, and we're proud to be a partner with the federal government. We think that's the only way fundamentally to solve this crisis, and we're proud to be a part of it. Thank you.
Thank you very much. I appreciate it, Sam. Please.
I'm Mikkel Moore. I'm Chief Community Health Officer for Intermountain Healthcare. Intermountain's based in Salt Lake City, Utah, a not-for-profit integrated system. We're testing about 65% of those getting tested in our communities right now, and the surge is fairly small in our community. And we believe that this is going to be a long-term...
much of a problem relative to other places?
Yeah, relative to other places and not yet. And we know that this is going to be a dynamic situation. And so we appreciate the opportunity to collaborate with the federal government and with our colleagues, hospitals across the country, because we think flexibility is really important to being able to meet the needs.
What tests are you using?
We're using a few different tests. We have some BioFire tests.
Some of the Abbott tests?
Mm-hmm.
How do you find the Abbott tests? Quick?
Yes.
But
fast.
you're finding the antibody tests, are you using that too?
We're just exploring antibody tests right now. Want to be careful about how we deploy that, and
Right.
because we don't have many people who've been exposed to the disease in our communities, it might not be time
That's
yet
great.
for antibody testing. So.
That's good. How many cases do you have, would you say, in your community?
We have about 2,400 in the state of Utah.
It's relatively very small.
Relatively small, and
you'll keep
gives
it
us
that way.
concern about what can happen if we
Right,
relax, but we are being diligent.
Yeah, it's a great job. You've done a great job. Thank you very much. Please.
Mr. President, I'm David Dill. I'm the President and CEO of LifePoint Health. We own and operate 88 hospitals spread out through 29 states in smaller communities, which I know are communities very important to you. We applaud the efforts of your administration on dispersing the $30 billion in funds quickly. Our ask is that we continue to deploy the remaining $70 billion. Rural hospitals are a very important part of the infrastructure of this country, and also treating the uninsured and the Medicaid population as well. So thank you for what you've done. We have not seen a significant surge at this point either, although our caregivers have done a fantastic job of preparing, and we are...
What area do you cover mostly, David?
All over the country, 29 different states. Think about the middle part of the country. We don't have we don't have any hospitals on the West Coast in California, also in the Northeast, but virtually every state in between are where we have hospitals.
Places that don't have the big hot spots, right?
That's right. We only have a couple of hundred COVID patients today in our hospitals.
Wow.
Our biggest risk, I believe, are nursing homes, and so protecting our nursing homes, making sure that our nursing homes are stable.
And so you're very careful.
And we're very careful
That's
there.
Great.
Yeah.
Great job, David.
Thank
you
you.
very much. Joseph?
Mr. President, Joe Impeachike, President and CEO of Ascension. I represent 165,000 associates
Yeah.
in communities across the country. We have 150 hospitals in 20 states. We're proud to be part of this partnership and appreciate your leadership, Mr. President. And I'd like to thank you and Vice President Pence for everything you're doing.
I appreciate it very much. Thank you. Good job you're doing, too.
I'm Rick Pollack. I'm president of the American Hospital Association, and thank you, Mr. President, for having us in. And want you to know that we appreciate the leadership of you and your team in putting together this dynamic reserve for the ventilators. You know, you've already heard that there's a little bit of an uneven impact in terms of the disease and the battle that we're fighting. And this will allow us to provide an opportunity to flex, so that we can get the equipment to the right places at the right time for those that are really struggling. And this is an innovative approach that we're committed to. The hospital systems around this table have stepped up to the plate to make commitments, and you have our commitment at the American Hospital Association that we will work with the rest of our field to make additional commitments and make this a success.
So, Rick, we're also building a very high-quality ventilator because you have to make a decision. And I was told it makes a big difference. The level of quality of a ventilator, what is it? What is the difference? Do you find it makes a big difference? They're obviously more expensive, more detailed, harder to build, but I hear they are more effective quite a bit. Do you all consider that to be correct?
That's correct.
A ventilator is not a ventilator. There are a lot of different versions of them
That's
that
right.
have different capabilities.
So we're building the one that they say is, we're trying to go at a standard that's very high. And you think that's worth it?
We think this project
Makes
is
a
very
difference.
well worth it. Absolutely.
If it makes a difference, yeah. Very good. Thank you. Great job. Please.
Mr. President, Warner Thomas, I'm the CEO of Ochsner Health in New Orleans. We're the largest not-for-profit health system in Louisiana. We've been caring for about 60 to 65% of the COVID patients in New Orleans, over a third of them for the entire state. So we have seen an escalation over the past few weeks, although we're seeing some flattening of that curve now, and we're excited to be part of this program. I want to thank you and your administration, and certainly our governor, who was helpful in getting ventilators to us when we were going through the process. Yeah.
We got them to him.
Yeah.
We sent a lot of ventilators to your state, and we've been working very well with your governor and with your two senators, too. by the
We
way.
appreciate that. It made a huge difference for our patients, and we're excited to be part of this program so we could help other communities that may be in need of ventilators as well.
We also built you a lot of hospitals and hospital beds in particular.
Yes.
And we just cut back on the final because you didn't need them, which was great. You didn't need them. So you're seeing a flattening right now, right?
We are seeing some flattening of the curve, and certainly we're hopeful that continues, over the next couple of weeks, and the shelter in place has had a major impact in our city.
Fantastic. Great job. Say hello. Please.
Mr. President, my name is Fritz Francois. I serve as the Chief Medical Officer at NYU Langone Health. Ken sends his regards. And as you know, we've been taking care of patients not only in Manhattan, but also our cohort is in Brooklyn, as well as Long Island. And we've been in the heart of it. And do want to really thank you for not only supporting NYU, but also the New York hospitals. We've been in the hot zone. And similarly, we're actually seeing a bit of a flattening. And we're continuing and committed to taking care of these patients. So once again, thank you for all your efforts.
I spoke to Ken yesterday. We'll take care of all the situation. You people have really done a fantastic job during this crisis. Please.
Yeah, Mr. President, my name is Tommy Hadovich. I'm the president and CEO of Cleveland Clinic.
Good.
We have a strong presence, obviously, in our home state of Ohio, but also a large presence in Florida, southeast coast
That's
of
right.
Florida.
You built a big one, right?
Yes, we built a
That's
big
right.
one.
Very good.
Fortunately, in Ohio, the measures by our governor were instituted very early, and we have really not had a surge in the number of patients.
Right.
And the curve has been flat for almost 2 weeks. In our entire system, we employ 60,000 caregivers. We're having only 170 patients in our entire system, and the number has been stable. And what I would also like to echo my colleagues here, that we're thankful for the invitation, but I also want to assure that we all collaborate among each other and lend a helping hand to those who are in need. So thank you very much.
Well, that's great. And you do have a great governor. Mike has done a great job.
He has done a really, really
And
good
we
job.
appreciate it very much. So we're going to talk for a couple of minutes, and thank you all very much, media. Thank you.
Mr. President, will you issue your new guidelines in a day or two?
Let's go.
Press, thank you.
All right, folks, thank you so much for joining us and choosing us as your news source. President Trump meeting with healthcare executives at the White House. We're going to have more information of who was actually in the room, what companies, and what CEOs and their names on our website, goldenstatetimes.com, if you want to check that out. But if you did enjoy our coverage of President Trump meeting with healthcare executives, make sure to share the video, click the thumbs up button, subscribe, and click the notification bell. Also, don't forget to join us in just probably like a little bit less than an hour, 45 minutes max. We are going to start streaming President Trump's press briefing, so make sure you guys join us for that. Thank you so much, folks, once again, for choosing Golden State Times. We hope to see you guys at President Trump's press briefing. The link should be in the comments below, pinned to the very top, or it should also be coming up on your screen. We hope that you guys join us on that live stream, and we will see you very soon. Peace.